When examining the elbow, you must start off and exclude problems in the neck, the shoulder, and the wrist and hands. The next is inspection of the elbow. You want to see are there any deformities, so you ask the patient you're looking for, and you can see what the various valgus angles of both the hands. You want to inspect the anterior aspect. You're looking for any scars. You turn the arm in. You look at the lateral aspect. You want to see the inside. If you bring both the arms up like this, I find the easiest way. You can look at the lateral, posterior, and you can look at the medial aspect, so you're not missing any scars or posterior swelling. And you can compare to the opposite side, where most of the swelling is laterally or under the triceps. Inspection. So come down. You also want to inspect the hand to make sure there's no wasting, especially of the ulnar nerve around the ulnar nerve on both sides of the hands. The next is palpation. We start on the lateral aspect. You want to see the palpation of the lateral epicondyle. The radial head is just distal. At the same time as palpating the radial head, you should palpate the distal radial ulnar joint, and you can rotate it underneath there, feeling for crepitus at the same time. The posterior lateral recess for posterior impingement and osteoarthritis, as well as arthritis in the joint. You can palpate the posterior aspect of the triceps and over the olecranon tip. We come into the medial aspect of the elbow, posterior aspect of the olecranon, and the ulnar nerve is along between the medial epicondyle and the olecranon. You can palpate it down round into the flexor mass, and you can tip on here, and you'll get symptoms down onto the hand. You can palpate further up to see if there's any pain along the ligament of Stradus. The next is palpation of the medial epicondyle just anteriorly, where the medial epicondylitis came from. The medial collateral ligament is from the epicondyle to the ulnar, and you can actually see my finger rotating over the medial collateral ligament. Next is the flexor mass and the pronator onto the coronary tip and anterior biceps and brachioradialis. You can then palpate the bicep tendon down 2 centimeters distal onto the radius where the biceps inserts and over the radial head proximally. Tenderness over this area may be a radial nerve problem as it comes around the elbow, around the lateral part of the humerus, and the posterior interosseous nerve is in just below the flexor mass above the radial head. So it's inspection, palpation. The best place to see swelling is usually in the lateral recess or posterior aspect of the elbow. Movement is you can do a quick screen, but remember I showed you going like this, like that, and then straight as far as you can go. Elbows in front of you again, and keep your thumb out like that. Make a fist, yeah, but keep your thumbs hanging out, yeah, like that, and turn in and out while keeping your elbow. The special test. So let's do a special test. The first is for lateral epicondylitis. So there's the epicondyle just anterior to the epicondyle. It will be tendinous over there. There may be wasting around the extensors. You hyperextend the elbow, keep it there, and you ask them to keep it there, and that's a stretch. Or you ask them now to do a resisted force against you, that's fine. Or you keep the hand up to the top there, keep it there, and resisted force against that side. The next is the middle finger test, so pushes up to the roof, and that's supposed to give you either pain if you have a posterior interosseous nerve entrapment, or it actually is tenderness from the lateral epicondyle. The same as on the opposite side, the tenderness of the medial epicondyle just anterior to the epicondyle is where the medial epicondylitis occurs. Once again, you hyperextend the hand, drop it right down, resist it, that's extension. Okay, now you get them to push up again, that's pain. Or you ask them to hold it up there and keep it there. That gives you the tenderness over there. The next is the medial collateral ligament. It runs from the medial epicondyle to the ulnar. You can palpate the ligament over the aspect of there. You check the instability by doing the milk test. You hold the thumb in that position, you hyperextend. You can palpate over the ligament, and as you flex, okay, just relax, as you flex, you can actually palpate the pain over there. You get pain in the mid-arc, which disappears as they hyperextend, unless they have impingement of their olecranon tip into the posterior fossa. The next test is for the biceps. The insertion is 2 centimeters distal on the radius. There's tenderness over the distal bicep, and you ask them to keep the hand there and resist its supination, so keep it there. You can see the biceps now contracting. You can see the biceps tendon coming down, inserting onto there, and then you can do the hook test where you can get your finger behind the biceps, and you can see if it's been ruptured. You will also see deformity of the distal biceps. The other test for biceps is the same as for the shoulder. Pull up to the roof, that's a speed test, and if they get pain of the distal biceps there. The posterolateral instability, I think that's it, eh? What else? Ulnar nerve. So let's have a look at the side here. So the ulnar nerve, we've done the palpation round and the tap test. You then must look for wasting and sensation on the little finger and half of the middle finger, with wasting of the hypothenar muscle and the intrinsics on the back of the hand with a loss of strength. I'm just going to show the hyperflexion test of the elbow. This is to test for cubital tunnel test. Okay, so elbow flexion test. Okay. The next is the lateral collateral ligament. It runs from the lateral collateral just behind the radial head, which is there, to insert on the ulnar. You can palpate it over it, and this is the posterolateral draw test. So exactly like the knee in 90 degrees, you want to lift and dislocate the radial head out of the joint. So you can palpate the radial head, and at the same time now you do direct, just lift the elbow up and feel if there's any instability at the radiocapitellar joint. The next test is the posterolateral rotatory pivot shift test. The arm is put into supination. A valgus force is applied onto the elbow and an axial load, so you want to direct the force down that way, and you go from full flexion into that position all the way into extension, and you're looking and waiting for a clunk of the radial head coming out the back there, which may be there, and then as you flex up, it'll reduce as you come back in that position. Okay. The other instability test is bringing them around here. When you do the instability test, you must bring them out of extension to unlock the olecranon, and you can actually hold the arm and just do them into various valgus instability tests. Okay, that's about it.